Suzanne Schillaci. I am a licensed esthetician here in the state of California, and I'm going to be talking about teen acne and what you can do at home with some simple things you might already have around the house or maybe over the counter, and when to see a professional or when to see a medical doctor. First, let's talk about what acne is. Acne is hormonally driven. You're going to start seeing signs of acne when you see little bumps on the skin, usually in the T-zone area. That's where the oil glands are going to mature first. And also when you see your teen maybe having more hair on their arms and legs, you know hormones are really kicking in. There's going to be more oil production and more skin production, turning around the skin cells instead of sloughing off or falling back down into the follicle and getting stuck with the oil. We always have bacteria on our face, and when this bacteria, it's healthy for us, but when it gets in the follicle and it gets aggravated and it gets stuck with the oil and the skin cells, that's when you get a pimple. Okay, so when you start seeing those first signs, it's good to have your teen start some kind of gentle facial routine and then progress up from there. If they get in the habit of having a routine, they can head off acne at its worst. Acne takes 90 days to form before it makes its appearance at the top of the skin. So it's good to stay on top of it and get ahead of it. So to get clear skin, you do need a daily routine. You need the right products. You need commitment, which is going to take time. So it can take anywhere from 3 months or more to clear up your acne. Less sugar, more water, and regular facial treatments when they're allowed. I will be talking a little bit more about each of these. So things you can do at home, you want to make available to your teen water, not soda, things without sugar, and fruits and vegetables, so that you can also increase your water intake through fruits and vegetables. Water will help keep the follicles from getting the follicle lining from getting too sticky and oil sticking to it and skin cells. Greatly help water. I can tell when someone's not drinking enough water by how dried out and how clogged up their pores are when I have them on my table. Another thing you can do is change their pillowcases every night. I will suggest to my teen clients to take their pillow and take several pillowcases and pull pillowcases over and then strip off one each night. It's good to have white pillowcases, white sheets, and white towels when you're dealing with a teen that's using some of the products for acne, because benzoyl peroxide, which is very helpful with acne, will bleach out your towels and your sheets. So keep that in mind. And again, about laundry, it's very helpful to try to eliminate fragrance and softener free in your laundry detergents. Some of the products you can use that you can find over the counter and easily, readily available is benzoyl peroxide and salicylic acid, some toners with astringent, they call them astringents or astringent toners, witch hazel. Your more effective ones are going to be benzoyl peroxide and salicylic acid when it comes to acne, and you're going to want to start off with the benzoyl peroxide at a low percentage. Otherwise, you're going to dry your face out. Don't start off with Oxy 10 or Oxy 5. You can find 2.5%. That's what I start my clients off with. They need to wash their hair and wash their body at least once a day. This will help wash everything off there, get skin cells moving, oil moving, bacteria off. One of the most beneficial things they can do at home is ice. Icing inflammation will bring down the acne inflammation and greatly reduce the time the acne is on the face. You just need to take an ice cube, wrap it up in a paper towel, and massage your acne lesions, especially when you're seeing red. You want to get the ice cube on there and massage it in gentle circles. And I say, half the ice cube on one side and half the other half on the other side. That's all it takes, is maybe 1.5 minutes to 2 minutes. I like to tell my teens to do it at least twice a day. I'm happy if they do it once, but twice is going to be ideal. One product I like to look for, and one thing I use in my practice, is a saturated pad that has some kind of ingredient on it, like benzoyl peroxide or salicylic acid or some other types of acid. The pad is already saturated. It's super easy for your teen to use. I like them to first wash their face and then use the pad to make sure everything is off the face. After that, I like them to use something that's a humectant to keep moisture into the skin. So humectants are products like aloe vera, or even more commonly known as aloe vera, but hyaluronic acid is definitely going to hold the moisture into the skin and attract it from the air. When it comes to the diet, I don't like to tell the teens not to eat things, but we've got to start somewhere and got to keep in the back of your mind that they may need to reduce their sugar intake. Sugar feeds inflammation, and it definitely does not help acne. They definitely want to think about cutting out cow milk, dairy, and maybe substitute almond milk. My teens say that the almond milk tastes exactly the same when it comes to drinking milk. A good source of essential fatty acids and a supplement is very helpful for inflammation. It's been found in clinical studies to reduce the inflammation in acne when you use omega-3 with some omega-6 and combine it with a zinc. And this will bring down the inflammation, helping you fight it internally. I like to just remind parents to try to not bring up the subject of the acne unless they're bringing it up to you. Provide them with what they need to wash their face, to take care of their face, and then let them figure it out. And when they need extra help or they're complaining about it, that's when you take the next step, either seeing an esthetician or taking them to the doctor. The other things I ask my clients not to do at home is to use scrubs or mechanical brushes like the Clarisonic. One, because scrubs are usually too irritating to the skin and they can spread bacteria around. Mechanical brushes will strip the barrier of the skin, and they're overused, and they're better for the backs of the arms and the chest. Scrubs also. Limiting peanuts and peanut butter. Peanuts and peanut butter will increase androgens in the body, so that will also upregulate the testosterone, producing more testosterone, which will then increase the oil production. And the most important thing not to do is no picking and scratching at acne lesions. If your teen is suffering from very painful acne, big nodules, cysts that do not resolve after weeks, that's a good time to see a doctor. If they have something on their face that does not have a border, that's not circular, it doesn't have clear borders, and is very painful and red, you should see a doctor. If they have tiny white clusters of little whiteheads around the mouth area and the nose, that could be perioral dermatitis. All of these that I'm talking about probably will need some antibiotics, and you should see your medical provider. When it comes to acne scars, I like to treat them as I'm going along the treatment with certain types of topicals, but sometimes we have to wait until acne is resolved. But because teens are usually in really good health, and if they have a good diet, the acne scars will fade, and we can, by the time they're a lot older, they'll be gone. But most important is that they are completely protecting their skin with sunscreen at all times. It's also important to keep the skin hydrated and not too dried out, because that will hold onto pigment. Of course, if they don't pick, if they ice, and if they keep the skin hydrated and covered with sunscreen, there's less chance of scarring. There are a lot of different options to deal with scarring, but we can't do some of them if you're in the middle of big acne breakouts. Maskne. Acne around this area has been a big problem with people that have to wear the masks for all day long. And when school gets back in session, this could be an aggravating factor. I tell my clients to let's get multiple masks and throw them in the wash every night and rotate them throughout the day so they're clean. Bring along astringent pads, medicated pads, and wipe down the area. Keep the skin also hydrated, and maybe try out getting some that are different shapes or different types of strings or held onto the face differently so that there's not continual friction in the same area. Just remember that consistency and commitment is where you're going to see the biggest improvement in skin. Clear skin happens if someone is very committed into getting it, and using the right products for their skin type. It's definitely possible. I've got some great before and afters. I've had some great outcomes with some of my clients that I was concerned for, and that's all without antibiotics, so it can be done. If you have any questions, just leave them down below and I'm happy to answer them. my name's Suzanne, and thank you for listening. Hope this was helpful.